Hi guys, this is Dr. Denny Warren with Generations Health and Wellness Center, and I want to address one thing today. And you know, a lot of times we're told a lot of these illnesses are genetic. It's like, oh, I have heart disease, but it's genetic. I had one gentleman come in to me one time as a patient here in my office, and he said, oh, I have a really bad knee. But yeah, that's genetic. My dad had bad knees. Well, he didn't even talk about that car accident where he slammed his knees into the dashboard. That's not genetic. So the thing is, what is genetic, what's not? There are genetic illnesses. There are genetic syndromes. So the thing is, like, if you look at all the illnesses that we have, it's roughly 2 to 5% of all the illnesses that we have are truly genetic and have a genetic cause. Whereas another 95 to 98% of those illnesses are lifestyle illnesses. The American Journal of Medicine is saying right now that 75 to 80% of all deaths in the United States are due to lifestyle. And so what I want you to know is all of those illnesses, virtually all of them, are lifestyle related. But let's take a look at the genetic ones. Let me give you an example of what a genetic syndrome or a genetic illness is. We've all heard of it. It's called Down syndrome. The actual name for Down syndrome is called trisomy 21. It means that you have an extra 21st chromosome. Now here's something I want you to think about when you think about someone who has Down syndrome or someone who has a truly genetic illness. Think about this. How early can you detect, or how early can you tell if someone has Down syndrome? If you think about that, you can actually detect that before the child's even born. They can check it in utero. There's tests that you can do where you can check and see if that child's going to have Down syndrome. Now, that child, you can tell it that early. They're going to be born with Down syndrome. So that child who has Down syndrome, think about their entire life, okay? Is there ever a time in their entire life where they do not have Down syndrome? No. So their entire life, there's not a time where they're like, oh, hey, I don't have it today, I'm feeling great, and oh, next week they have Down syndrome. They have it their entire life and they will die with Down syndrome. That's a 100% genetic syndrome or genetic illness. That's a genetic cause. You can't change your genes. But the thing is, when we look at heart disease, we develop it. When we look at cancer, we develop it. When we look at diabetes, we develop it. Obesity, we develop it. Alzheimer's, dementia, we develop it. MS, lupus, rheumatoid arthritis, all those things we continue to develop. So those are not truly genetic. It's coming from our lifestyle choices. Because if it's truly genetic, you cannot change it. But you can change the expression of your genes. So let's go back and let's look at that person with Down syndrome. What if you gave that person with Down syndrome the best nutrition possible, the best walking or exercise plan possible, and you fed that person with Down syndrome, you fed them with the most loving thoughts, the most appreciative and caring and grateful thoughts? Is that person with Down syndrome going to have a better quality of life if they have that? For sure. Again, it's 100% genetic because you can't change it, but you can still give them the best quality of life by addressing other lifestyle issues. And so as you continue to get these small drops, these video clips, you're going to get more and more information about things that are genetically congruent with what your genes need in order to express health, balance, and homeostasis. So I hope this helps clear up some things. In the next video, I'm actually going to talk about a couple different genes that they're blaming illnesses on. I'm going to talk about how it's not really the gene's fault, but it's the choices that causes the expression of those genes. And this will help you, because so many people are going to tell you, so many people that, yeah, it's genetic, depression's genetic, all these things are genetic. But this will help you understand that in more detail. So look forward to that, and I'll see you soon.